करती हूँ तो मैं वहां पर पहुंचूंगी। हो गया बस।
मैडम आप सब चक्कर आ जाए फिर will take care.
That's wonderful.
का काम बड़ी ट्रेन करवा ली है हमें।
भाई मैं तो की थी जहाज, मैं वो जहाज टूट गया, मैं बेचा को मजबूर हूँ।
So we are the chairpersons of this webinar, Professor Mahmood Al Hassan. He is President Pakistan Cardiac Society, and he is interventional cardiologist in Khyber Girls Teaching Hospital, Peshawar.
Mashallah.
So he invited for the his introductory comments when he will. Our other chairperson, amongst the other chairpersons, Professor Rajkumar Sajjigani. He is President-elect Pakistan Cardiac Society, Professor and Head of the Department of Cardiology, Ghulam Ahmad Nahar, Medical College, Sakhar. Our third speaker is Professor Nazir Mehman, ex-head of the Department of Cardiology, Liaquat University of Health and Sciences, Karachi. Then Dr. Professor Rashid Rashid Khan.
Ahmad nahi.
He is consultant cardiologist. Okay, Rashid Khan. KIHD, PHL, and visiting professor of the Karachi Institute of Heart Diseases at Karachi. And then our next professor, Honorable Professor Mansoor Ahmad. He was the ex-head of the Department of Cardiology in Liaquat University of Liaquat National Hospital. Nowadays, he is working as an interventional cardiologist and head of the Department of Cardiology at
Medicare.
मैं बिल्कुल नाम भूल गई हूँ उससे।
Medicare.
हाँ, Medicare. Medicare hospital.
One correction is needed.
Then our next chairperson is Dr. Saira Bukhari. She is a consultant cardiologist and head of the cardiology services, Aga Khan University Hospital, Karachi. We are with us, Dr. Nusrat Ara Majid. I will include her amongst the chairpersons, and she will be playing the role of chairpersons in this webinar. So, among the speakers, Dr. Maria Kaz, Senior Registrar, Global Medical College, University Hospital. She will be a speaker, our speaker. And then Dr. Zairi Jarrah, Consultant Cardiologist, Aga Khan University Hospital, Karachi. She will be also giving her talk in this webinar. Professor Nabila Soomro, she is the head of Institute of Institute of Physical Medicine and Rehabilitation, Karachi. She will be with us as the last speaker in this webinar. Coming to the World Heart Day. Why historically, if we see that CVD has been a leading cause of death in the United States in 1918, with men carrying the bulk of this burden for decades. In 1970, CVD death began to rise. So,
मुझे presentation
increased death rate. World Heart Federation, in conjunction with the World Health Organization, announced the establishment of the World Heart Day in 1999. The idea of this event was proposed by Anthony Bias,
Luna.
president of the World Heart Federation from the 1997 to 1999. Originally, the World Heart Day was observed on Sunday of September, but this was only till 2011. The first celebration took place in September 2024-2000. First World Heart Day was celebrated in Pakistan in 1999 in NICD by the efforts of Professor Azhar Faruqi. Next slide. During, as a coordinator of the local chapter, I remember most of our chairpersons are from this group. Professor Masood Ahmad was also in that World Heart Day celebration in 2016. In Hyderabad, in Hilale Amar in 2021, the Cardiac Institute celebrated and Flower Medical College celebrated World Heart Day in 2021. I remember this institute because Maria Kazi was the focal person along with Dr. Gulhasan in this celebration of World Heart Day. She is a speaker with us today. World Heart Day celebrated in KICT in 2020, and Dr. Rashid, we can see he was taking part in the celebration. Our third speaker, Dr. is also was also celebrating in World Heart Day in the Indus Medical College and was a speaker in 2013. Okay. So this was really a remarkable event which we celebrated in the Movenpick Hotel in 2000, most probably 16, and with a celebrity. Next slide. Why we celebrate World Heart Day? The prevalence of IHD and metabolic syndrome, because in this month we are also celebrating the metabolic syndrome, which is more common in the women. So it is 49 versus 34.8 in males. It is a leading cause of the CVD in women, 30% of the women. And physical inactivity is more common in women, leading to obesity, hypertension, diabetes, especially at the menopausal age. Depression is again an important cause due to the social insecurity for the complications of the after MR in women. So, keeping in view of these risk factors, we decided to celebrate to organize this World Heart Day. On this day, because we are most of us will be engaged in the PHL conference on the 27th of September. So this webinar is in for the celebration of the World Heart Day. We have only 1 hour and a half today. Each presentation of our speakers will last for 20 minutes and followed by the 3 minutes question answer session and discussion with the rest of the chairpersons. I would like to take opinion from the chairpersons whether they would like to have their comments during the presentations or in beginning. So it will be much better to have their comments during the after every presentation. Okay.
Okay.
So, Maria.
Yes, madam.
Professor Azhar Faruqi
Assalamualaikum,
is
madam.
with us. I'm really happy to see him.
Assalamualaikum.
Assalamu alaikum, madam.
Assalamualaikum, sir. Assalamualaikum. Maria, are you
Ji, ji, yes, assalamu alaikum.
are you sharing your slides?
Yes, yes, ji, yes, madam. Madam, I'm ready now.
Yes.
Okay,
Share
go
kar
ahead.
Share your slides.
Yes, madam.
Huh?
Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Maria Kazi. I'm a senior registrar of cardiology at Bilawal Medical College, Liaquat University, Jamshoro. First of all, I would like to thank Madam Dr. Khalida Soomro Saiba for inviting me in such a wonderful platform on special, very special World Heart Day. Again, thank you, madam. So today's my topic is, are you listening?
Yes, please go ahead. Yes.
Okay, okay. Heart smart living, innovative lifestyle strategies for women's cardiovascular heart health. So heart healthy, understanding your risk, making healthy choices, and taking steps to reduce your chances of getting heart disease. Heart disease is the leading cause of death among women, and women who have complications during pregnancy, such as high blood pressure or gestational diabetes, have a significantly high risk of heart disease and stroke later in life, according to the new scientific statement from the American Heart Association. Mortality associated with acute MI among women younger than 65 years of age is almost twice than men. High blood pressure is the most prevalent cardiovascular condition during pregnancy. Women who experience pregnancy have a 2 to 4 fold higher risk of developing chronic hypertension between 2 years after compared to women with normal blood pressure. High blood pressure, a major risk factor for heart disease, accounts for 20% of deaths in women, and obesity has a particularly high impact on the development of high pressure in women. Other gender-specific risk factors include early onset of menstruation during puberty, premature menopause, inflammatory and autoimmune disorders, depression, and anxiety, particularly at younger ages. Pregnancy complications such as high blood pressure, diabetes, preterm delivery, and low and high birth weight infants. Chemotherapy for cancers that occur primarily in women with as breast cancers. Women who have had gestational diabetes are 8 times more likely to develop subsequent type 2 diabetes compared with the women who did not have gestational diabetes. Obesity increases the risk for high blood pressure during pregnancy, gestational diabetes, and future heart disease. So, obesity is also associated with the persistent high blood pressure after pregnancies. Risk factors: diabetes. Diabetes increases the risk of cardiovascular health diseases 3 to 5 in versus 2 to 3 times in men. Diabetic women who smoke have a 84% higher risk of developing stroke than non-smoker. Women with history of one or more adverse pregnancy outcomes experience heart attack and stroke at younger ages compared to the women who have race, ethnicity, especially black ethnicity, and the prevalence of complications and are key contributors to the disparities in prenatal heart risk factors. So the preventable risk: smoking. 50% of heart attacks among women are due to the smoking. Smokers tend to have their, ये मैं यूएस की स्टडी बता रही हूँ. Smokers have their first heart attack 10 years earlier than the non-smokers. If you smoke, you are 4 to 6 times more likely to suffer a heart attack and increase your risk of a stroke. Women who smoke and take oral contraceptives increase their risk of heart disease 30 times. Care that may best reduce cardiovascular risk in women who had pregnancy complications. and treatment of the heart disease, such blood pressure, type 2 diabetes, high cholesterol after pregnancy may help prevent attack, heart failure, and stroke, especially among those who have experienced one or more patients during pregnancy. By identifying women at a younger age, we will be able to act earlier to prevent and treat risk factors and promote the lifestyle changes. Will be critical to us long and treatment complications. Many women face significant barrier in assessing the primary care after delivery. Up to percent of the women do not assess postpartum care, and only an estimated 18 to 25% of the postpartum patients with pregnancy complication or chronic health conditions are seen by the primary care with the delivery. About 80 to 90% of the cardiovascular disease is preventable. Implementing preventive strategies early could have a significant impact on reducing the premature cardiovascular disease, stroke, and related mortality for women. So these 8 outlines I'm going to share you life essentials, a few easy steps you can take to live a healthier lifestyle. More, be more active. Elder in physical activity or 75 minutes per week. Vigorous physical activity. Walking is a great moderate level activity. Eating healthy. Choose more fruits, high fiber diets, vegetables, whole grains, cereals. Choose baked, skinless chicken per and low dairy products. Eat less fat, especially eat less saturated fat, trans fatty acids are more contained in are more present in the bakery items. So high fiber diet, dried beans found dried beans, peas, oats, fruits, and vegetables. So advanced fatty acids, the LDL lower the HDL, increase risk of the heart disease, stroke, type 2 diabetes, and trans fats found in the fried cookies, cakes, crackers, snack foods. So replace the trans fat with the polyunsaturated fats. Get enough sleep. Getting a good night's sleep every night is vital to cardiovascular health. Adults should aim for an average of 7 to 9 hours. Too much sleep is associated with disease. Studies sleep helps heal and repair your heart and blood vessels. It also healthy balance hormones that make you feel hungry or full. Support Sleep supports the health development and also support the healthy immune system. A study of 3,000 middle-aged women found that insomnia and short sleep duration were both associated with a higher risk of cardiovascular disease later in life, underscoring the need to address sleep problems to reduce the women heart disease risk at their age. Can better reflect long-term control in people with diabetes or pre-diabetes. Manage the blood pressure. Keeping your blood pressure within acceptable ranges can keep you healthier longer. Levels less than 122 millimeter of the mercury are optimal, and high blood pressure associated with the obesity or oral contraceptive pills. So sodium, we should restrict the sodiums to 1500 milligram per day and control the cholesterol, because high level of the non-HDL or bad cholesterol LDL can lead to heart disease. Your healthcare professional can consider non-HDL cholesterol as the preferred number to monitor rather than the total cholesterol. So it should be non-HDL cholesterol means the LDL should be less than 100 milligram per deciliter in non-cardiovascular health diseases. So limit the dietary cholesterol can raise the blood cholesterol. So limit the food high in cholesterol like liver, organ meat, egg, yolk, heart association less than 300 milligram per day and less than 200 milligram per day with diabetes or heart diseases. Um, Lower the stress, improve your mental health. Talking to a professional counselor, participating in a stress management program, practicing the meditations, trying relaxing techniques like deep inspiration, talking with the weight, achieving and maintaining a healthy weight loss as optimal BMI for most adults ranges from 18.5 to less than 25. Waist circumference should be below 35 inches for women and below 40 inches for men. So thank you for patience listening. Over to you, madam. Hello?
जी hello.
We can hear you, but Dr. Khalida नहीं सुन रही.
Thank you, Dr. Maria. Thank you.
Thank you, madam.
मेरा जो है ना बैटरी बहुत खत्म हो रही है.
Please feel free to type your questions in the chat, and Dr. Maria Kazi and our chairperson will address them. अगर आपको
खालदा मेरी बैटरी खत्म हो रही है और बिजली नहीं है. आई एम अफ्रेड आई मे नॉट.
चलो ठीक है.
अच्छा.
If you want to comment, please comment on the Maria Kazi's presentation.
Okay. Yeah, thank you. As usual, you know, it was very good. I heard her for the first time. But of course, the usual things that we have been emphasizing on for the last so many years. And okay, diet, sleep, etc., exercise is okay. But I would just like to comment on stress. It is so very unfortunate that it has become one factor in our lives here in Pakistan or maybe elsewhere as well, which cannot be avoided. You are on the road, somebody is blowing horn, somebody is throwing things from the window. I have to stop. I burn my blood. I have to tell them anyway. People are not aware of the basic civil, what are the requirements of living in a civil society. And then regarding this women and metabolic syndrome and stress, you know, whenever patients come to me, I've been observing that for the last so many years. And you ask them about how many children. Doctor साहब मैं तो दिल की बीमारी के लिए आई हूँ, आप कहाँ बच्चों की बात, वो तो इतने साल पहले था. You know, the scenario in our setup is that the multiple pregnancies, joint family system, and then the wrong myths that after delivery you are not supposed to move for at least 2 to 3 months. So what happens is, and then there is tremendous financial pressure, and you don't have the liberty to do things that you want to in a joint family system. What happens is that, you know, the women begins to put on weight, फिर tension भी है, सामान भी नहीं है करने का, and meanwhile she gets pregnant for the next child. Then again the same thing is repeated. This obesity gives rise to diabetes, then with hypertension, and this is how these women are more prone to have ischemic heart at a younger age. And of course, these are all the classical settings of your metabolic syndrome. So how to address that? You know, there's so many things that need to be addressed about joint family system. But you know, at times if you actually try, कि मैडम कमरे से दूसरे कमरे जाओ तो सास बुला देती है, पहले ये करो, बच्चा है, ये है. So I keep wondering, I mean, and the stresses are different in different classes of women. I mean, talking about my own self, you know, by the grace of God, there is nothing to be stressed about. But even then, at every step of life, you know, you come across something that is not what it should have been, and that at least puts me in stress. And I think, thank you so much. The rest of the presentation, of course, very good. And lifestyle we keep on, but you know, one has to think of ये तो government के साथ मिलके on the road, you know, horn blowing, जो basic humanity और decency के खिलाफ चीजें हैं that are being practiced, and at least for a person like me, that is a tremendous stress. Thank you, Khalida.
We are lucky. Faruqi, I remember he started celebrating World Heart Day in Pakistan, and in my presentation, I showed the glimpse of the views, photographs of the celebrations. I would like to have on World Heart Day how he started and the comments on the area of the presentation.
ये मौजूद है डॉक्टर फारूकी?
Yes,
I'm there. I'm there.
Oh, what a pleasure, sir. Very good
Welcome,
afternoon.
sir.
How
Welcome.
very nice.
Thank-
How very nice.
Always a
What a-
pleasure to see you.
Thank you.
Oh,
Thank you, dear friends.
yeah. A very
Assalamualaikum,
pleasant
sir.
surprise. Wow.
Thank
Sir,
you.
I'm Dr.
Looking
Amber
good.
from Peshawar. Assalamualaikum. Nice to see all of you.
Walaikum assalam. It is a pleasure, Dr. Khalida, and I'm so happy to see old friends and colleagues. And it is so kind of you to invite me to this Zoom webinar. All I can add is that, I joined Dow Medical College as a medical student in 1965. After becoming a doctor, going to States, I came back and joined NICD. So, I've been in this game now almost more than a few years. At the time, cardiologist, the prevention was that there is very little heart disease in women. So you can, when a woman complains of chest pain, we used to just ignore it. But now we know, and we have so much data that eventually the women is protected, no question, until menopause. After menopause, then women have higher heart disease and cardiac deaths than men. So I think. Sorry. I will conclude shortly. What I want to say is that now we know that eventually towards the end of life, women have more heart disease than men. And therefore, we need to be much more vigilant in women. When a woman complains of chest pain and cardiac symptoms, in particular, if she is postmenopausal. So what your speaker, Dr. Maria, emphasized are now prevailing facts that everyone should know about, and primary care physicians besides cardiologists. And Dr. Khalida and her group, Go Women for Red, has done a wonderful job in raising awareness and sitting 10,000 miles away with the help of technology. It is a wonder to be part of this excellent deliberation. I thank you, Dr. Khalida.
Thank you so much,
Great. Good
sir,
to see
for
you,
your
Dr.
presence
Faruqi.
with us and
You're looking good.
encouraging us in this forum. So,
Thank you.
now
Just-
moving to our next
Just a second.
speaker.
I'm awfully sorry. I didn't know Dr. Faruqi was around. He should have been the first one to comment, but I'm sorry without knowing. So I made the comment. I'm awfully sorry for that.
No, not at all. It's a
Yes,
pleasure
sir.
hearing you and
Yeah.
seeing you well. You look well.
Which one I'm not posting? Everything I'm posting. See, which one I'm not posting? Just check now. Today also I post.
Posting, but you are not confirming the patient, na? I am the one.
Already, you talk with patient. After that, I'm sending this one. Then
We are now moving to our next speaker, Dr. Derek Gerard. She will speak on topic from stress to serenity, lifestyle changes to boost the woman's heart health.
Thank you,
Dr.
Dr.
Derek, are you there?
Yes, I'm here, Dr. Khalida.
So share your slides.
Okay, thank you. I'll just share my slides. Okay. So, good afternoon, everybody. My name is Dr. Zirak. I am a senior instructor at the Aga Khan University Hospital. I would like to talk about from stress to serenity, lifestyle changes to boost women's health. So I'll start my my presentation by talking about and to say that heart disease is the leading cause of death for women globally. So the American Heart Association says that 1 in 5 females die due to heart diseases. And women's symptoms and risks, they're quite different from the men's risks and symptoms, because women's hormones, biological structure, psychosocial differences affect how heart diseases present in women. So what we need to do is we need to explore essential lifestyle modifications that can significantly improve women's heart health. So we know that, as our doctor was saying here, that stress is the #1 factor that needs to be looked into. So chronic stress, what it does to the body is increases cortisol levels, leading to inflammation and hypertension in the body. And this is also linked to unhealthy behaviors like overeating, smoking, and lack of physical activity. And she was so right to say how in our local social context, how women are restricted into households, do not have access to physical activity, time to for going for a walk or for exercise, and often indulge in overeating. So women under chronic stress have a 60% higher risk of heart disease, which is something very alarming to see in our context. So as she mentioned, that we need to look at lifestyle changes so that we can reduce this risk. Lifestyle modifications include 3 major categories, which is nutrition, physical activity, and sleep. So a Mediterranean diet, which is rich in fruits, vegetables, whole grains, and lean proteins, are shown to be very effective for a healthy heart. And from the New England Journal of Medicine, a Mediterranean diet has shown to have proven a 25% lower risk for cardiovascular disease. There are lots of studies, including the Predimed diet or the Volo study, which shows that a Mediterranean diet includes nuts, olive oil, lots of vegetables, and lean meat like fish, which is proven to reduce the risk of cardiovascular disease. Physical activity also includes at least 150 minutes of moderate aerobic exercise per week. In our society, unfortunately, most women are unable to achieve this target and to get even moderate amounts of exercise per week. So, but unfortunately, this needs to be changed. We need to come up with research and more interventions to look into how women can be encouraged to take out time for physical activity while managing their jobs and their homes at the same time. So physical activity does reduce the risk of coronary artery disease by 30% in women. And then the third most important thing is to manage sleep. 7 to 9 hours per night reduces the risk of hypertension and heart disease. And women who sleep less than 6 hours a night have a 20% higher chance of heart failure as well. So sleep is also very important in our context. Women are often deprived of sleep due to multiple reasons in their homes or at work, and often lead to insomnia and different, and this leads to builds up over a period of time to cause hypertension and heart disease. So there are some techniques that women can do at home easily. Mind-body approaches is what it is called, and it includes meditation. Meditation is proven a 10-minute daily meditation can reduce systolic blood pressure by 5 to 8 millimeters of artery. So according to the American Heart Association. This is something that can be done anywhere and at any time, where you can sit down for 10 minutes daily and just focus on your breathing, and you can reduce your blood pressure by 5 to 8 millimeters of mercury. So yoga is also another thing which is very effective, and it combines breathing, relaxation, and physical postures to reduce stress. Yoga is also something which is trending now in Pakistan, where a lot of women are focusing towards yoga and meditation. It has become a trend, but it needs to be built into more how it can manage stress and reduce blood pressure. So yoga reduces heart disease risk markers in women as well, including cholesterol and inflammatory markers. And then deep breathing exercises. Wherever you are, in any place, if you're sitting in your office, if you're sitting at your desk right now, you can do simple breathing for seconds, and that can activate your parasympathetic system. It can reduce your heart rate and it can promote relaxation. So these are 3 tips which can actively manage stress and actively regulate your heartbeat as well. So this is the next step is the power of communication, which shows us how basically social support and talking it out with your colleagues or with people that you trust really helps. So with strong social connections have 50% reduced risk of developing heart that need to be looked into how mindful and meaningful interactions reduce heart risk and support each other for that. They could be through a community, through different group activities, through mental health support, and looking into how we can get together and support each other on a social level. So obviously, we know major risk factors like smoking and alcohol are habits that need to be avoided because smoking increases the risk of coronary heart disease in women by 2 to 3 times as compared to non-smokers. And alcohol consumption, although says may have protective benefits, but excessive alcohol increases the risk of heart disease. But now I think the latest research also shows that even a moderate amount is not good for the body. So the Women's Health Initiative found that smoking cessation reduces heart disease risk by 30% in the first 5 years. So in our local context, it's very important to see that women in enclosed houses, in closed spaces, in communities, in small settlements, they often are resorting to not only first-hand but second-hand smoking as well, where they don't have adequate ventilation in the households, which also resorts to them inhaling smoke. And that is also very, very harmful for women in the household. So this is hormonal changes where we know that females' bodies are very different to how they are from the males' bodies, and menopause and heart health is also something very important. As estrogen declines during menopause, that also increases the heart risk in women. So hormone replacement therapy it needs to be evaluated on a case-by-case basis due to its potential risks and benefits. Overall, a holistic lifestyle integration needs to be all factors, including stress management, nutrition, physical activity, social connections, habits, and risk factors that can contribute to long-term heart health. Lifestyle modifications are interdependent, and a holistic approach needs to be made. So you see, we talk about stress management, we talk about diet, we talk about physical activity, social connections, and harmful habits, and all of these are interconnected. None of them are in isolation with each other. So we need to be very careful when we talk about just guiding somebody about, oh, you should do this and you should do that, and we need to be making a holistic approach towards counseling a patient or towards guiding them towards a healthier habit, including how much that is possible given their condition in their environment, around the people they're with, and how they can better manage their stress. So in conclusion, stress is a significant risk factor for heart disease in women, but it can be managed. Simple evidence-based lifestyle changes such as diet, exercise, sleep can be managed to improve heart health, and it is never too late to start making positive changes. So we need to all take small manageable steps to reduce stress and improve heart health. Thank you. Dr. Khalida, you're on mute.
Thank you. Thank you for your insightful presentation. And stress is really a problem nowadays of urban area women who has double role to play in this society. That is home and her office. So I would like now to Dr. Mansoor, who is with us, to give her his comments on this topic. And anybody has questions on the presentation of Derek, write your questions in the chat box. Dr. Mansoor, are you there?
I have a question with Madam Zira.
Yes.
How
Maria,
will-
are you
Can
asking
you hear
question?
me?
Yes, ma'am. So how will
Can-
we improve stress management by CBT, cognitive behavioral therapy?
Okay, this, I think it is a difficult question about stress, because to gauge stress is not always easy. Can you hear me?
Yes, we are hearing you, Dr.
Okay.
Mansoor.
Yeah, because I was muted and my video is also stopped. I don't know why. But anyway, I think it's a very difficult thing to gauge, because one person's spy can be somebody else's poison. So common things cannot be evolved for relaxation. But of course, we have learned about meditation, yoga. I personally advise exercise. Exercise helps reduce the stress, because unless we take stress, all of us must have taken a lot of stress to be what we are today, because if you do not take stress, you achieve nothing. So it has to be adjusted. But I usually advise not to avoid stress, but learn how to release stress. There are various ways, as our young cardiologist has defined, that is meditation and exercise. Physical exercise is another way. Now, about exercise in our society, it's not always easy. We always advise 150 minutes of exercise every week, but is it really possible? How many of us can get out of our houses and walk? So what I'm advising these days is, particularly for the ladies and those who are not so able to walk long distances, that they should, within their homes, within their rooms, even bedrooms, they must walk for 5 minutes nonstop every hour. That means for 12 hours, if they take 5 minutes walk, it will give them a cumulative of 1 hour's walk, because fitness level matters, the knees matters, breathlessness matters, and of course, most of them have no habit of exercise. And of course, forget about going out, because very few of us are privileged to have walking tracks or parks near our houses. So this is how I advise exercise to my families, to my patients and family, of course. And of course, exercise, whether it's physical, it's mental, or whatever. I think this is very, very important in reducing the risk. The data suggests that it does reduce the risk of heart attacks and reduces blood pressure very significantly. So it must be practiced and advised routinely. And my congratulations to our young ladies of cardiology. They have showed more maturity in their talks than many of us so-called seasoned speakers. Thank you so much. Great talks, both of them. And I look forward to listening to the third one also. And again, congratulations to Dr. Khalida.
Thank you so much, Dr. Mansoor, for your encouraging comments. Now I will invite Dr. Rajkumar Sajivani to have his comments.
Thank you very much, madam. Actually, I think you are serving the true goals of the Pakistan Cardiac Society, because we want to aware the masses. And these talks are basically because we always say prevention is better than cure. And these messages are very up to the point and reflecting the message of Pakistan Cardiac Society. You have been the president of Pakistan Cardiac Society. You have been working a lot. One thing which I want to highlight, before that, I would like to pay thanks to Azhar Farooqi Saab, who has been always kind and our guide and mentor, as well as I saw Professor Nazir Mehman Saab. So I just want to say that as obesity is nowadays also increasing in Pakistan, and that is one of the issue. And that is measured by body mass index, but nowadays they recommend that the hip waist ratio is would be more appropriate to do. And second thing that we always say that whenever there happen, we must reduce the salt. But if you are in Lakhar, Larkar, and Jacobabad and Multan, you see that already here people are sweating a lot and they are losing their salt in the sweat. Properly conveyed to the salt. Because in this season, if we stop taking salt, and other consequences are much again, madam, and thank you.
Thank you. Thank you,
Hello.
Dr. Moving to Gary, to answer the question of Dr. Maria Kazi, which she asked after her presentation. Gary, will
Yes,
you
yes,
like
Dr.
to
Khan.
answer the question of Maria?
Yes, Maria, can you please repeat your question?
Maria,
Yes, sir.
what was your question?
I said, how will we improve our mental stress, reduce the mental stress by CBT, cognitive behavioral therapy? How we manage our stress by this technique?
So, cognitive behavioral therapy is recommended by a psychologist. Once you are referred by your doctor to a psychologist, or you decide to go to a psychologist directly, cognitive behavioral therapy is a method that is incorporated to include different exercises like mindfulness, and of course deep breathing exercises, and it includes basically monitoring your thoughts. It actually focuses on looking at your thoughts and focusing on them and then letting them go. So these are also some techniques which are used for managing stress. But CBT is also used mostly towards other stressful mental health conditions like depression. So these are actually some of the techniques which are used. But yes, if you go to a psychologist, they can guide you and they can monitor your progress as you go through cognitive behavioral therapy, as it's a method for therapy which only a psychologist can do.
So much.
Thanks, Dr. Zarid. Now we are moving to Dr. Nabila Soomro, and she will speak on her topic. Dr. Nabila.
Ji Khalida, Assalamu alaikum to all the participants, and thank you, Khalida, for giving us opportunity to be with our colleagues and to be with the general public and spread this message. And it makes me happy when cardiologists have started realizing the importance of cardiopulmonary rehabilitation. So since time is short, so I'll quickly, and my special salams to senior Dr. Azhar Farooqi sir. We are privileged to have you here.
Thank you.
Me as a student just had a 1-month rotation at an ICVD during my rehab medicine training and physiatry training, and it was really inspiring at that time. So my special salams to you.
Thank you, ma'am.
So let's begin. The first cardiopulmonary rehab was established at Institute of Physical Medicine and Rehabilitation, which is the only public sector civilian multidisciplinary rehabilitation institute for musculoskeletal cardiopulmonary neurological pediatric rehab. And second, multidisciplinary uh, service established at NICVD about 4 years back. So I would like to just highlight simply that what is cardiopulmonary rehab? It's just an individualized multidisciplinary approach to providing cardiac patients with an optimal recovery. So, of course, you cover all the aspects. So, cardiac rehab has 3 phases. Can we pass on to the, and it's a teamwork. So, cardiac surgeon or physician, physiatrist or rehab medicine specialist, physical therapist, nutritionist, psychologist, and rehab nurse. They are very important components of the team, and they're all important members of the team. And if we miss on one member, then it's really difficult to proceed forward. We can add on more members as per needed, like most of our cardiac patients have stroke also. So we can add on neurologists and so on. If our cardiac patient is an amputee, we can also add on a prosthetic and orthotic team member in a group. So next. So there are 3 phases of cardiac rehab. Phase 1 is when we get hold of the patient in the ward, whether post-surgery, post-PCI, or heart failure. So these are the formats I've developed, that we start from 1 to 2 meds, and then we gradually discharge the patient, ideally on 3 to 4 meds, so that when he gradually goes to phase 2, he's able to process from 4 meds activities onwards. So just for a revision for our cardiac colleagues, that 1 med activity is like when we are sitting quiet or we are lying down. So we are using 3.5 ml of oxygen per kg per minute. So that's 1 ml, 1 med. So as we exercise and as we move, as we increase our physical activity, our meds increase. So, with the time constraint, I'm just sharing these the one which I have developed, that what should be done on day 1 and how should the patients be progressed with subsequent meds so that we can discharge them accordingly. So these are the protocols which I'm sharing. We were talking about that it's very difficult to exercise, and women at home, our community, our social constraints. So calisthenics came into being, that we can also increase the intensity and repetition of certain exercises and increase our met activity, energy activities while sitting, while lying down. So now there are many options that even if you don't go out, you can spare little time at home, and then while on the bed, while on the mat, you can still exercise and lose calories. Next. Phase 2, when patient is discharged and they are referred to us, and we get hold of the patient, is phase 1. And then in phase 2, being a part of international cardiopulmonary rehab, the top risk factors nowadays are 5. They say if you control these, then you don't have to worry about your diabetes, your hyperlipidemia, your hypertension, and your BMI. So those top risk factors, of course, are physical inactivity. So हर कोई यही कहता है, अक्सर आप सुनते हैं कि जी हम तो चलते फिरते रहते हैं सारा दिन. So एक दिन हमने भी ये सोचा, जब हमने अपनी वॉच में स्टेप्स काउंट किए, तो वो मुश्किल से 6000 भी नहीं हो रहे थे. So physical activity means कि at least 10,000 steps per day, जो आपके मुश्किल से 150 minutes per week. This is a minimum requirement to keep your health going, I would say. Because exercise is not only for heart, but for everything. Since time is a few simple tips to monitor your pulse rate and just get going. but start little, start soon. Second is nutrition. Nutrition may, of course, a colleague spoke about a diet, that Mediterranean diet. Mediterranean is full of vegetable, fruits and nuts. Then DASH diet, which is low in sodium. But अगर मोटी मोटी चीजें आपको बतानी है तो उनसे कहें कि जी बेकरी प्रोडक्ट्स लिमिट ट्रांस फाइबर डे कि हम कितने बेकरी प्रोडक्ट्स खाते होंगे एंड 1 liter oil of vegetable origin is enough per month for one person. Sodium 8 teaspoon. So चटनियाँ अचार और ये सब शुगर जैसा मैंने आपको कहा कि शुगर आपको 2 years से पहले तो अब पीडियाट्रिशियंस बच्चों को शुगर देते ही नहीं है तो शुगर इनटेक भी मैंने आपको बताया कि सपोजिंग यू ओनली अलाउड और शुगर फ्रूट्स में भी होती है so 8 to 9 teaspoon से कम including fruit sugars fibers at least 30 grams so if we have a combination of fruits and vegetables that adds up into it so मैंने अभी अब मैं आपको न्यूट्रिशनल चार्ट जो हमने एक डिजाइन किया है I'll share और उस पे हम करेंगे आगे psychosocial factors में आपका the type of personality you have anxiety, depression, sleep, and then your social, the kind of, socially आप अपने आप को कैसे carry करते हैं, tobacco and smoking, chewing and obesity. मैं ये revise करूँगी कि last जो हमारे Asians के लिए जो एक हद मुकर्रर की गई है, that's for men 36 inches and below and for women 32 inches and below. तो बड़ी कोशिश के बावजूद हम भी अभी 32 तक नहीं पहुंच पाए so but these are the guidelines for Asian women. Next, so physical activity का मैंने ये international physical activity questionnaire इसमें डाला है कि जब आप आज घर जाएं तो हम सब अपनी physical activity को monitor करें और देखें कि where do we fall. Next. So once we fill up this physical activity questionnaire, we know where do we fall. Do we fall in category 1? Do we fall in category 2? Or we fall in category 3? Category 1 is considered physically inactive nowadays. So agar aap less than 3 days vigorous activity nahi kar rahe hain of less than 20 minutes या less than 5 days से ज़्यादा नहीं कर रहे हैं 30 minutes तो you're falling in category 1. आप मतलब physically active नहीं है. हम पहले physically inactive उन लोगों को समझते थे जो लोग bedridden होते थे या पलंग पे ही होते थे. So since I don't have time, so this if anyone interested can just take home message this. Next. किस तरह हम अपनी फिजिकल एक्टिविटी खुद भी कर सकते हैं? Course, telemetry monitor when you have the privilege of being next to a tertiary care hospital. Maximum heart rate 22 minus age करके हम अपना निकाल सकते हैं और उसका 50% जो वैल्यू आती है उससे हम वॉक स्टार्ट कर सकते हैं. 6-minute walk test is another very simple way to assess कि उस दौरान कितनी breathlessness से क्या है. And talk test. While you are walking with a colleague, आप अपनी speed खुद monitor कर सकते हैं. अगर if you can talk well to them without breathlessness, that's your comfortable speed. Next. So this is that with time you have to follow principle. Frequency आपको बढ़ानी पड़ेगी. Start with which, however, जितने भी minutes आप start करें, increase it up to at least 30 to 60 minutes. Frequency 3 times a week तो आप कहते हैं resistance और vigorous करें and 5 times a week aerobic करें. Type आप खुद choose कर सकते हैं. You want to walk, you want to swim, you want to jog, whatever. Time, of course. 40-45 minutes is minimum. जितना आप बढ़ाएंगे आपके लिए अपना बेहतर है. Next. रेजिस्टेंस ट्रेनिंग की बहुत इंपॉर्टेंस हो गई आजकल, इसलिए कि आपका जो भी आपका कॉमनेस्ट कॉज ऑफ ऑल डिजीजेस एंड इमोबिलिटी है सार्कोपीनिया. सो जितना आप अपने मसल को बिल्डअप रखेंगे, यू विल डू रेजिस्टेंस एक्सरसाइजेस. अब तो थेराबैंड्स आ गई हैं, जरूरी नहीं आप डंबल्स जाएं, अपने कोई जिम जाएं, कहीं भी जाएं. ऑल यू हैव टू डू इज टू, आपको थेराबैंड्स आप घर पे खरीदें, उनमें डिफरेंट वेट्स कलर्स में मिलती हैं. आप किसी भी खिड़की से बांध लें, पलंग से बांध दें, कहीं भी बांध दें. यू विल हैव योर ओन दिस थिंग. You will have your own, like you can develop your own program. So next, न्यूट्रिशनल काउंसलिंग और असेसमेंट के लिए मैंने ये चार्ट डेवलप कर लिया है, जिसमें ये बहुत फेमस प्लेट है. जो भी आपके प्लेट की साइज हो, उसको आधा फ्रूट्स और वेजिटेबल से भरे, आधा ब्राउन से भरे. इधर ब्राउन राइस और ब्राउन ब्रेड, या होल व्हीट, या आपके चने का आटा, या जो भी आप जौ का आटा ले लें, ज्वार का ले लें. और 1/4 प्लेट में इधर फिश और चिकन of 6 ounce, यानी छोटा सा 6 inches का पीस. नेक्स्ट, ये सारी है कि कौन सी वेजिटेबल्स किस तरह आप कलर वाइज दिन में कितनी ले सकते हैं इजिली. नेक्स्ट, ये उर्दू में ट्रांसलेटेड है कि कौन सा ऑयल, कितना पानी, कितना आप ले सकते हैं, सॉल्ट, कौन सी शुगर, क्या अवॉइड. सो दिस वी ट्रांसलेटेड. ऑलिव ऑयल, शुगर अब पाकिस्तान इंडस्ट्री भी बना रही है, सो इट्स इजियर. वरना कोई भी वेजिटेबल ओरिजिन का ऑयल विच इज नॉट हाइड्रोजनेटेड. नेक्स्ट, साइकोसोशल असेसमेंट के लिए मैंने 2 सिंपल फॉर्म्स डेवलप किए हैं. यू कैन स्क्रीन योर पेशेंट्स, पर्सनालिटी भी, एंजाइटी भी, डिप्रेशन भी. तो जो न्यूरोसाइकोलॉजिस्ट हमारी टीम में काम करता है, दे विल इमीडिएटली टेक देम ओवर. और of course cognitive behavioral therapy is very important again in this. अभी हमारे colleague ने point out किया था, just to sustain that behavior temporary तो बहुत easily हो सकता है, लेकिन to sustain it and to continue it is the main. So our psychologists are trained for it, so that they have a continued, these lifestyle behaviors are just continued. Next. Next. So these are all the forms which we have developed, and I'm just sharing it with you, because time will not allow to. Next, sleep apnea question here. Sleep apnea, again, our colleagues spoke about sleep duration and the best time to sleep between Maghrib and Fajr. I won't comment on that, but sleep apnea again is a major cause of cardiac events. Smoking, ये मैंने एक क्वेश्चन ये डेवलप किया है, इसमें आप स्मोक send it to a cardiopulmonary rehab team and they will work on it. Next, waist size, as I already spoke, कि क्या होनी चाहिए. BMI एक आम आदमी के लिए मेजर करना मुश्किल है, so the world has now moved to waist size. Next, phase 3, जो आपके cardiac rehab का, you just stick to your lifestyle changes. जो भी risk factors आपके हैं, उनमें आप किस तरह उनको continue कर सकते हैं और उनके benefits देख सकते हैं. So they must have a team where they can go back and forth with their issues and lifestyle changes. Next. This is my last slide. Barriers क्या हैं? Barriers जो है हमारे cardiac rehabilitation में is lack of awareness among healthcare professionals. कि cardiac rehab भी कोई चीज होती है, उनका function क्या है, what is the role of a cardiac rehab physician. Most of you are trained abroad, they don't allow any cardiac hospital to operate without a cardiac rehab ward because उनकी तो country pay करती है or insurance pays. So they make sure that mortality and mobility decreases. So they don't, neither cardiologist, neither a rehab physician gets paid until and unless patient is out after 6 weeks of cardio pulmonary rehab. So यहाँ lack of awareness among healthcare professionals है, lack of awareness patients में भी है, lack of expertise of cardiac rehab specialists. That's again a major factor. Lack of multidisciplinary cardiac rehab services. अगर आप ideally देखें तो ये services इस वक्त एक Institute of Physical Medicine and Rehab में और एक NICVD में है. Failure to refer patients from phase 1 to phase 2 to a cardiac rehab team by cardiologists and cardiac surgeons, or lack of local cardiac rehab guidelines on which I'm working. कि किस तरह, I'm working with ICCPR team to develop economic and doable friendly guidelines for cardiac patients. अगर privately develop करते हैं तो cost is really high for cardiac, for the cost and duration of program is high. Luckily ये दोनों चीजें free हैं NICVD में भी और SIPMNR में भी, so the at least people cardiac patients should avail of those. और government funds की lacking है इस तरफ, so with time there will be awareness. And transport facility is again a major cause. हमने free offer कर दी, हमने state of art cardiac rehab बनाया, लेकिन 6 हफ्ते वही मरीज कहते हैं कि जी हम नहीं आ सकते क्योंकि हम 6 दफा मतलब हफ्ते में 3 दफा 6 हफ्ते आए जाएं. There's a lot of transport costs. So ये मेरे तजुर्बे से these were the barriers which I felt and I've experienced in my career. Thank you so much for your patience and time. Thank you.
For your insightful presentation.
Yes.
We will now open the floor for questions. Participants, please feel free to type your questions. We are having Professor Nazir from the Hyderabad. He was the head of the department of Liaquat Medical College and Liaquat Medical University, and also from the Indus Medical College Cardiology Department. He is with us. So I would like to have his comments on the presentation of Dr. Nabila Soomro. Dr. Professor Nazir Ahmad Lemon. Will you like to give your comments? Nazir?
Yeah, Dr. Khalida, once Professor Nazir has finished, I would like to make a few comments for a minute.
I will.
Yes, thank you. Yes, thank you.
Dr. Nazir? Professor Nazir? Can you hear me, Professor Nazir Sir? Huh? Unmute yourself. You can give
Professor
your
Nazir,
comments.
Nazir साहब unmute करें.
Yeah, I think we can hear you now.
Hello.
Message correct. Meanwhile, Dr. Rashid or Dr. Mansoor can give their comments now.
But Rashid sir, go on.
No, sir, पहले आप बोल लें, मैं आगे बोलूँ.
But in fact, only thing is cardiac rehab was something that was introduced and I remember publishing a paper here in from I think it was Medical Spectrum from Pakistan Medical Association on cardiac rehab in 1985-86, and even then we realized it was rehab mobility was the name of the game. Most of the mortality that has gone down over the last 70 years, more than 50% of it. Sorry, Most of the mortality that has gone down post-infarct since over last 70 years is actually related to early mobilization. Because almost 30% patient used to die during post after going home because they were advised 3 months bed rest. And that bed rest caused more mortality than mobility. So now important that Dr. Soomro that has highlighted this issue, that mobility is the name of the game. People are scared post-MI, and the society norms are such that after every illness or during every illness, bed rest is the name of the game. We must understand that this is lethal. So these four actions that have been given in this particular talk on mobility, exercise, rehabilitation is very important to remove the fear in patients and their families. So the program has been initiated. Thank you very much. Yes.
Thank you very much, sir. So, I'm thankful to Khalida Soomro, who invited me to this August gathering. After a long time, I've seen Professor Azhar Farooqi as well, and I'm seeing that he is still much, despite he's got a lot of, looks very healthy. So may Allah Ta'ala bless him always, and he should be
Ameen.
keep alive and healthy. Were excellent. The way focus on modification. The treatment of cardiac diseases is very expensive and it's still going treatment the main disease follow lifestyle modification. And lifestyle modification, as all three speakers are talking, so in lifestyle modification, doing exercises, having a proper diet, and having a hip too, and definitely it is very important. As far as the cardiac rehabilitation centers are concerned, it is the now it is mandatory center should have the rehabilitation. I think in the private setup there are few centers who are doing the cardiac rehabilitation, but stress should be more. Every center where as well as Professor Mansoor said, early mobilization is the key for decreasing morbidity and mortality. Initially, when we were started our career, वाकई से भी होता था कि पेशेंट को आपने लटाया और मॉर्फिन देते रहे जब तक उसको पेन जो है वो लीव ना जाए. एक समय उस्ताद कहा करते थे, kill the pain, otherwise pain will kill the patient. So the moment there was no other way except these things. So hence the mortality was very high. By the grace of God, that early mobilization and better diet advice and better exercise advice has considerably reduced the morbidity and mortality, and along with the latest treatment. So I think this sort of program should be continued, and I hope in next program like this, we should include the common man as well. So much so they should learn what talking and what. Thank you very much.
If I may go next, please.
Professor Nadeer, will you like to give comment?
नदीर साहब आप अनम्यूट कर लें, आप म्यूट हैं. खालिदा इनको अनम्यूट करवा दें, ये म्यूट हैं, वो म्यूट अनम्यूट नहीं हो पा रहे हैं.
सर की तरफ अनम्यूट किया हुआ है अपने आप को.
जो अपना मैं बोले उनको अनम्यूट कर दें. नदीर साहब जो है म्यूटेड है.
अपने आप अनम्यूट कर दें अपने आप. माइक को क्लिक करें।
मैम आपके पास यहाँ जो मेन होस्ट है उसे बोलें कि उन्हें अनम्यूट कर दें।
नहीं कर देगा,
हाँ,
वही तो मैं कह रहा
कर
हूँ।
दिया है, वहां से किया हुआ है, सर की तरफ से प्रॉब्लम।
नदीर साहब म्यूटेड है।
या मैं भी थोड़ा ऐड कर दूं, मेरे भी बड़ा फनी हुआ था, मैं भी म्यूट हुआ था, वीडियो मेरा अभी भी बंद है एंड आई डोंट नो हाउ टू रीस्टार्ट। मैंने मेरा ख्याल है जस्ट fiddled around और suddenly unmute हो गया हूँ, but this must have happened with Nazir.
प्रॉपर्ली साहब उसे नीचे जो है ना स्क्रीन के नीचे दोनों ऑप्शन है म्यूट तो कैमरे के।
क्या तो क्लिक करके comments and their
Yes, madam. Assalamu alaikum. Thank you for this opportunity, especially to comment in the presence of such luminaries. Jazakallah for this opportunity. I really wanted to comment after the cardiac rehab presentation, as other esteemed colleagues have also done, because I'm a great believer in cardiac rehab. I think it does wonders. And I think the most important thing it does is it prevents frailty. My suggestion is that all cardiac centers should have a rehab program. And also we should use cardiac rehab to get elderly patients or patients above 50 who have never exercised, get them to get mobilized safely so that they may start increased physical activity and improve their health. Thank you so much.
unmute yourself. Screen unmute person. Dr. Sumera, Dr. Amber Ashraf, will you add your comments?
Yes, ma'am. Can I?
Yes.
Assalamu alaikum. Thank you very much for giving me an opportunity. First of all, I would like to congratulate Pakistan Cardiac Society for selecting such a dynamic leader for GoRed for Women, who has really motivated all of us. And cardiac diseases and women health is becoming more and more important for all of us, and we are looking forward for it. Ma'am, it's a wonderful activity. All the three presentations are the need of the day. And basically, as most of our senior cardiologists have highlighted, because if we spend a day in a cath lab performing 6 to 8 PCIs, what is the disease burden? How the non-communicable diseases are increasing day by day. So that is the high time we start working on the primary prevention as well as the primordial prevention. But those patients and females especially who are coming secondary prevention, post-PCI and cardiac rehab, it is the need of the day. Because most of the time, what happened without mobilizing those patients, without doing a risk stratification, the patient being, and that's why the heart failure pandemic and burden is towards a rise in our all four promises. That's what I'm observing and collecting data in my own teaching hospital, and that's really alarming for that. So the cardiac rehab is the need of the day, and we all should have to work on it. And really, the way ma'am has presented all these, and there should be a guidelines from Pakistan Cardiac Society, because Mahmood is around, ma'am, you are around, and the rest of the Dr. Kumar is here. So in the next year, I think so we should have to work on these guidelines as well, so that it should be generalized all over the Pakistan. And thank you very much. I really feel very good to see Professor Azhar Farooqi Saab. Many prayers for him. Dr. Mansoor Saab, and the way he comment and teach us, I always recall and remember my exams and things like this. and really appreciate all of the presenters as well as the panelists. Thank you very much. And special salam to Dr. Nusrat. Thank you, ma'am.
Well, Nazir, are you still?
नजीर साहब का म्यूट है मैडम अभी तक।
हमारे पास से नहीं है ना, यहाँ से नहीं है। हमने वो पाकिस्तान कैडेट सोसाइटी ने भी उनको, एडमिन ने उनको मैसेज भेजा है, लेकिन वो शायद वो देख नहीं रहे हैं उस मैसेज को।
मैम
हमारी
उन्हें
तरफ से
मोबाइल पे
नहीं है।
कोई रिंग कर दे, मैम सर को मोबाइल पे कोई रिंग कर दे और फिर उन्हें वॉइस में गाइड करे तो
आप
हेल्प
लोग कर दें, क्योंकि मेरे पास उसका नंबर नहीं है यहाँ पर।
अच्छा मैम मैं करती हूँ।
हाँ प्लीज। Meanwhile, we are having Professor Azhar Faruqi. We would like to have his final comments as well.
Thank you, Dr. Khalida. It has been wonderful. The three talks were very good. I may want to add something. You know, I'm sitting 10,000 miles away from you, and I can hear you perfectly, and you probably can hear my comments as well. So while you are having trouble within Pakistan, but 10,000 miles away from states, it looks like I'm sitting right next to the conference hall. My final comments I would add, as far as pulmonary rehabilitation is concerned, to the young Dr. Soomro, I may add that in the early 80s, I started a cardiac rehab program at the NICVD, and I had an Australian team come and stay in Pakistan for a month and train doctors in cardiac rehab, and we started a rehab program. And so our efforts have been going on since 80s. And, you know, I mean, I served at the NICVD for over 30 years, and I was the director for over 12 years, and now I have been retired for over 16 years. So it's a long perspective, but the struggle seems to be going on, and I am so happy to see the progress that has been made in the NICVD rehabilitation program. So best of wishes. I am sorry that Dr. Nazir Memon could not connect in time. Would have loved to say hello to him after a long time. And I thank Dr. Khalida Soomro for an excellent symposium. Thank you.
So Dr. Nazir Memon doesn't seem to be coping with the problem of connecting with us. We'd like to say thanks to all the speakers and chairpersons who participated in our this webinar. And I would like to express our gratitude to our esteemed speakers for sharing their valuable insights. Your presentations have enlightening and thought-provoking for us. I would also like to thank you, chairpersons, for guiding us through the discussions and providing valuable input throughout the session. Big thanks to Professor Azhar Faruqi and the other participants for your active engagement. Thank you. We are concluding our webinar now. Thanks.
Thank you.
And we look forward for the future collaboration and continued support. And
Thank you.
Thank you, madam, so much.
Thank you, ma'am.
Thank you.
Allah
Thank
Hafiz.
you.
Take care.